I have a message for the President. Mr. President, I have a message for you. Your health care bill stinks, just as we said it did. As a matter of fact, your health care bill is a fraud. Your health care bill does not cover pre-existing needs for children, as you said it did. Your health care bill does, in fact, slash life-saving tests for senior citizens, as we said it did, including MRIs, CAT scans, diagnostic labs, home health, durable medical equipment, medical devices, nursing homes, inpatient rehab facilities, inpatient psych hospitals, etc. Did you know that, Mr. President? Your health care bill does change coverage for retirees who now receive prescription drug coverage from businesses and forces them on to Medicare Part D. You lied again, Mr. President. That's a change in coverage. At the same time, your health care bill is not $940 billion over 10 years, is it, Mr. President? You lied, didn't you? You fixed the books like Al Capone's accountant. When you add back $321 billion to cover payments to doctors under Medicare, and when you double counted $550 billion in Medicare cuts, you increase spending by over $2 trillion when we add in the rest. Don't you, Mr. President? You lied, didn't you? And if you were in the private sector, you'd be indicted and facing sure imprisonment, wouldn't you, Mr. President? And in fact, your health care bill does drive up costs for small businesses. If they offer a private plan to employees that exceeds some government-imposed limit, over time it's taxed at 40%. Why? And if these businesses don't offer health care to their employees, they're fined $2,000 per employee. Isn't that an expense? If they offer a health plan that is not approved by the government, they are fined for that as well. Isn't that an expense? Doesn't that change coverage? And if these small businesses don't offer health care to part-time workers, they're fined $2,000 a pop again. And your health care bill punishes young people and middle-class citizens, even though you said it wouldn't. You lied. As the great Bill McGurn reports in the Wall Street Journal today, almost by definition, those hit by your mandate will be either young people starting out or those working for smaller businesses that don't provide employees with health care coverage. The Congressional Budget Office and Joint Committee on Taxation estimated that nearly 46% of the mandate penalties will be paid by Americans under 30% of the poverty level. That's lower middle class people, Mr. President. You lied. In today's dollars, that works out to $32,500 for an individual. For a family of four, it's $66,150. Generally speaking, these are not the folks who have to worry about paying taxes on, say, a villa in the Dominican Republic or income from the International Monetary Fund. So we are left with one of two possibilities. The first is that the penalty for not having minimal essential coverage is fully enforced, in which case Americans of relatively modest means will get a lesson in how the government deals with people who don't pay up. Or the penalty for violating the individual mandate will become like the fines for not filling out your census form. In other words, unenforced. In that case, the cost of this legislation will be even higher and more hidden than we've been led to believe. You lied, Mr. President. And you lied about the cost of premiums, too, Mr. President. You said that premiums would go down on average $2,500 a year. The Associated Press is reporting that when the individual mandate kicks in, young adults under the age of 35 seeking coverage on the individual market would see premiums climb by 17%. That's not a $2,500 cut, is it, Mr. President? You lied. You also lied about the cost to the states, Mr. President. The Council of State Governments, according to the San Francisco Chronicle, estimates that your expansion of Medicaid alone will cost states $25 billion over the next 10 years, not including other significant administrative costs. And you lied when you said that your health care plan would increase efficiency, didn't you, Mr. President? Fact, it will create doctor shortages and long waiting periods. The Associated Press reports the obvious, that primary care physicians are already in short supply.